St John's says it hasn't been this concerned about an illegal drug since GHB came on the market many years ago. I asked its medical director, Dr. Tony Smith, what the ambulance service has seen recently.
We've seen what appears to be a sudden spike in patients suffering life-threatening problems following consuming synthetic cannabis, and we're sufficiently concerned about the possible link to want to send a warning to the public that these drugs appear to be very dangerous, and hence the reason for our wanting to publicise this.
What has happened? Can you give us more details about these deaths?
Well, we've currently being called up to approximately 20 times a day in Auckland to people suffering life-threatening problems following what appears to be synthetic cannabis. And those life-threatening problems include people being unconscious and or having seizures. And in a small number of cases, we've seen patients where their heart has suddenly and unexpectedly stopped. That's called a cardiac arrest. And we've certainly seen up to 7 people whose deaths in the last month appear to be possibly related to synthetic cannabis.
And when you say they are they linked because these people are getting their drugs from the same source?
We don't know that. We just don't have enough information on that at the moment to be able to provide that link.
And you haven't seen these figures before? These, like 7 deaths in 1 month and 20 people a day?
From other drugs?
Yeah, or from synthetic cannabis?
No. So something has changed. Whether it's the drug or the addition of another drug, we just don't have an answer to that at the moment. But clearly something has changed, and I know I haven't been this concerned about an illegal drug since GHB came on the market many years ago.
And what are they doing? Are they ringing 111? Are they turning up at emergency departments? What is happening?
So commonly what is happening is that they're becoming unconscious and or having seizures, and someone else is calling the ambulance. When we arrive, they're sometimes still unconscious. As they regain consciousness, it's common for them to have very disturbed and violent behaviour, and it's common for their violent behaviour to be sufficient that they're in immediate danger to themselves, a danger to the people around them, and a danger to the ambulance personnel and the healthcare personnel who are currently trying to help them. These drugs are of significant concern.
And what age are we talking about here? Young people?
We're seeing a range of ages, everything from teenagers all the way through to middle-aged people.
And you say that they're dangerous to the staff as well. What do you mean by that?
Well, they're commonly very violent, and it's common for one patient to need to have up to 2, 3 or 4 staff looking after them to keep them safe, because they can be very, very violent.
This is happening in Auckland. Are you aware of it happening in other parts of the country?
Yes, although the spike appears to be predominantly in Auckland at the moment, we are also starting to hear reports of cases outside of Auckland.
And in terms of the kind of treatment that these people need, what is it?
So there's no specific treatment for the drug. We just need to look after the patient and wait for the drug to go away. But the patients who are unconscious will commonly need people to look after their airway, that is to prevent their tongue from falling back and blocking their throat, to give medicines to control seizures, and to give medicines to control severe, agitated, violent behaviour.
Are there long-term effects from this drug use?
We just don't know that at this time.
So there's so much unknown about it.
There's a lot that we don't know. What we do know is that there appears to be a spike in patients with life-threatening problems, hence our reason for going to the public with a warning. Our absolute message is do not take these drugs. We believe that they're extremely dangerous. If someone does take these drugs and appears to have a life-threatening problem, for example, they're unconscious or having seizures, people need to immediately call 111 and ask for an ambulance.
And that's St John Medical Director Dr. Tony Smith.